Now, the Republicans have no support for their inaction plan on health care. Business isn't on board. Medical professionals aren't on board. So the righties, you know what they're doing? They're trying to lure doctors into this advertising campaign. Congressman Tom Price of Georgia, by the way, he's a doctor. He's sending faxes to doctors asking them to be a part of a physician's council to advise Congress. I mean, it sounds like he's asking for nonpartisan professional advice, except this council is owned and operated by the National Republican Congressional Committee. It's a righty campaign group, the NRCC, and Price are just pushing ideas that are completely nuts.
We will not rest until we make certain the government-run health care is ended.
That's Price's advice. End Medicare. Let's see, 94% of Americans who have it love it. That leaves seniors out on the street. Doctors don't support that. Now Price is trying to hook doctors into joining him in a Republican ad campaign. This is how they operate. Now, I've been getting emails from doctors who are absolutely furious about this, and I'm going to have one of them on this program on Monday. It's an interview that you're going to want to see. It cuts right to the chase. The Republicans don't have a plan. They're mean-spirited in their debate. They're talking hateful stuff about Barack Obama. Grandma's not going to get the plug pulled on her. There are no death panels. And now they're going out trying to get doctors on board, faking them into an ad campaign. This is what we're supposed to negotiate with? Joining me now is Sam Stein, political writer for the Huffington Post.
Hey, Ed.
How you doing?
I'm doing well.
Congratulations, you're married.
I am married, yes.
All right, good.
Best 3 weeks so far of my life.
Congratulations. Now you're back into it. Now I want to talk about it. When you left, what was the public option talk then, and what is it right now? Can you sense that things have changed?
Yeah, well, you see it in the polling data, obviously. When I left, that was the end of August, roughly, the narrative was essentially that the public option was dead. You had the popularity about 46%, 48% today in the CBS poll. We have it back up to about 65%. Talk on the Hill, you can sense, is people are generally more optimistic about it. Sherrod Brown, for instance, last night on this network spoke about how he thinks the votes are there for cloture when it comes down.
He even said Rahm Emanuel on my show. He said Rahm is wrong.
And I think it's telling that he is willing to call out the chief of staff of the White House on that. That said, not all news is great. There was this hint from Harry Reid today in a tele town hall that he did in Nevada where he praised the trigger. And I think that was a telltale sign that that's where he thinks the end game is, even though he personally is supportive of a public option. So it remains to be seen. I think the House is going to get a public option. I agree with the congressman. What happens in finance is key, and we'll see a vote on Tuesday, apparently.
And that is going to be interesting. It's I think, a great move by Senator Jay Rockefeller, who has said, look, we don't have a public option or guaranteed competition in a public forum for the private sector. So let's get all the Democrats on this committee on board and have them vote on a public option. This is going to be a real tough vote for Senator Conrad in North Dakota?
Sure. Well, Conrad actually, in an interview yesterday with the Washington Post, said he was not in favor of a public option. The question is, it's twofold. One is, who's going to blink first? I mean, you have these poll numbers. Democrats in Congress are enjoying better numbers than Republicans, resoundingly. Obama has gotten a boost in how he's handling health care. The public option is favorable. 76% of the public says the GOP has no plan. The question is, which conservative Democratic senator is going to blink and say, wow, the public is on the side of the Democratic Party. Why am I even entertaining this idea? The other question is, can cloture work? And I know there's a new campaign to get every Democrat committed to voting to end a Republican filibuster, but Ben Nelson's office reached out to me personally and said the senator is not committing to ending that filibuster. It's up to the leadership to corral those votes and say, listen, at the very least, procedurally, be with us.
But Ben has also said he's not going to vote for anything unless there's some Republicans on.
Yeah, I mean,
I am so struggling with some of the Democrats. Because the American people are with guaranteed competition for the private sector. They have got to realize that. They've got to realize how unfavorable the American people are viewing Republicans right now.
That's the other story we had. We got a memo today at the Huffington Post, and essentially what it said was, with the finance bill, they're mandating people to buy insurance, but they're not giving people the option of buying government insurance. And that is hugely unpopular when you poll in House swing districts, Blue Dog districts, and in the state of Maine. If you offer them the government option and you require them to buying shirts, all of a sudden, the popularity's through the roof. Now, when is a senator who's on the fence going to look at these numbers and say, okay, enough of this, I'm going to be on board? That's the question. And it also comes down to, can the White House convince them that this is the political, palatable way to go?
They don't want to go home and face the 30-second commercial saying that the taxes are going to go up now that we got health care reform. They're trying to figure out how to do this without having to be stuck with a tax increase for anybody, for that matter, even if it is just the top 2%. Sam Stein, back to work. Congratulations on no longer being a single dude.
Thank you.
And I think she's a lucky gal. You're a good guy.
I'm the lucky guy. So.